Hello everyone, in this video we are going to discuss about diaphragm. First is thoracic diaphragm. Apart from the thoracic diaphragm, there are other diaphragms in the body like pelvic diaphragm, cervical diaphragm, urogenital diaphragm. Today we are going to discuss about thoracic diaphragm. Diaphragm is nothing but a partition. So what does this thoracic diaphragm does is it partitions between the thoracic cavity and the abdominal cavity. So it acts like a partition. So coming to the diaphragm, thoracic diaphragm, it is a dome-shaped musculotendinous sheath which is present in the inferior part of the rib cage. So it have two domes, right dome and the left dome. Its origin is from the three parts, that is sternal part is from the xiphoid process, costal part is from the lower 6 ribs, that is 7th to 12th rib, and also its costal cartilages. Next, lumbar part is from the L1 to L3 vertebrae via the crura. Right side is from the L1 to L3, left side is from the L1 to L2, and the medial and the lateral arcuate ligaments. Insertion is at the central tendon, that is a thin, strong aponeurosis in the center. So coming to the openings, there are three major openings, that is at the T8 level, T10 level and the T12 level. At the T8 level, the main structures which are passing through this opening are the inferior vena cava and the right phrenic nerve. At the T10 level, esophagus and the vagus nerve. T12 level, aorta, esophagus vein and the thoracic duct. So we can remember by the mnemonic I8, 10x at 12. So we can remember by this mnemonic. So coming to the other structures, at T8 level it is a caval opening because inferior vena cava and the right phrenic nerve passes through it. T10 is the esophageal hiatus because esophagus is the main thing which is passing, and also along with this vagus nerve also passes, and also esophageal branch of the left gastric vessels also passes through it. T12 is the aortic hiatus because aorta along with the thoracic duct and the esophagus vein passes through it. And we have other opening like foramen of Morgagni, which is a sternocostal hiatus. Through this, the superior epigastric vessels, which are a branch of internal thoracic vessels, pass through it. And also at L1 to L2 levels, crura, that is right more than left crura. We know right is from the L1 to L3, left is from the L1 to L2. Here the greater and the lesser splanchnic nerve and the hemiesophagus vein passes, and lateral arcuate ligament here, subcostal nerves and vessels, and the medial arcuate ligament, sympathetic trunk, which is passing behind the diaphragm. So these are the openings. The major openings are the T8, T10 and the T12, which are caval, esophagus and the aortic hiatus. So nerve supply, coming to the, it have both motor and the sensory. Motor part is from the phrenic nerve, that is C3, C4, C5. And the sensory part, the central one is also supplied by the phrenic nerve only, but the peripheral sensory part is supplied by the lower intercostal nerves and the subcostal nerves. So coming to the function, so we know it is a primary muscle of inspiration. So whenever a person inspires, what happens is this diaphragm will contract and it will move downwards. So it will act like a piston. So piston movement is seen here. So as it moves downwards, there is increase in the thoracic volume. We know the volume is inversely related to the pressure. So there will be decrease in the pressure. So air enters from the atmosphere to the lung because in air the pressure is higher compared to the thoracic cavity. So because of this high pressure to low pressure, the air will move and it will enter through the lung. So it also assists in vomiting, defecation, urination, childbirth because it will increase the abdominal pressure. So next, so what are the clinical significance of this? Whenever there is phrenic nerve injury, like in trauma or surgery or any tumor which is compressing the C3 to C5, because this phrenic nerve is supplied, is the nerve root value is C3, C4 and C5. What it will cause is diaphragmatic paralysis. So here there will be elevated hemidiaphragm and also dyspnea. So we can see in this picture the right-sided diaphragmatic paralysis, where we can see right side is more elevated because of this paralysis. Next is hiatal hernia. It is a weakness in the esophageal hiatus, that is at the T10 level. The patient will have GERD, epigastric pain and also postprandial fullness. So in this picture we can see normal diaphragm. Normally diaphragm, the esophageal sphincter is below it, and in the hiatal hernia, it will, because of the weakness of this esophageal hiatus, it will move upward. So because of this, it causes hiatal hernia. Next is Bochdalek hernia. Here there is a posterolateral defect which is causing, it causes neonatal respiratory distress because the bowels will enter the thoracic cavity through this opening, and it will cause neonatal respiratory distress. And Morgagni hernia, it is similar to this, but there is an anteromedial defect. It passes through the foramen of Morgagni and the bowel herniation into the thoracic cavity, it causes similarly the lungs will be compressed by the bowel and there will be distress, respiratory distress, and referred shoulder pain. Here diaphragmatic irritation will be caused because pain at the shoulder is via the phrenic nerve. So C4 root value and also the phrenic nerve root value C3, C4, C5, it will match. So C4 level there will be referred pain whenever there is diaphragmatic irritation, like in abscess or any peritonitis. And also whenever there is irritation of diaphragm, hiccups will also occur in these cases. So this is the diaphragm and its clinical significance.